It starts as a dull pressure. You ignore it for a day. Then one night it wakes you up. A deep, electric throb that pulses with your heartbeat, radiating into your jaw, your ear, your skull. There is no pharmacy, dentist, or even a word for nerve. You are alive 9,000 years ago, and one of your molars has just declared war on you. So what do you actually do? Most people picture the answer as pure helpless suffering, maybe someone yanking the tooth out with a rock. Sometimes, yes, it came to that. But the real history is stranger and far more sophisticated than you would guess. Some of the oldest medical procedures humans ever performed were done on aching teeth. Let us start with what people believed was happening inside the tooth. For most of human history, across an astonishing range of cultures, the answer was the same: a worm. The toothworm was a hypothesis for the cause of cavities and toothache. Small worms living inside the tooth, slowly eating it away. The most famous record of this belief is a Babylonian text called The Legend of the Worm. The surviving copies are Neo-Assyrian tablets excavated at Nineveh and now held in the British Museum, dating to the 7th century BCE, though the tradition itself is considerably older. The poem imagines the worm being created from the mud of the marsh, then going before the gods and begging for its food. It asks to be placed between the tooth and the gum so it can drink the tooth's blood and gnaw the roots. Someone, almost 3,000 years ago, lay awake with the exact pain you have felt and reached for a story to explain it. That story stuck. Versions of the toothworm appear across the ancient and medieval world. In England, they were imagined like little eels, and in Germany as red, blue, and gray creatures. The belief outlived empires. Now here is where it gets surprising. Long before anyone wrote a word about worms, people were already drilling into teeth. In a Neolithic graveyard at Mehrgarh, in what is now Balochistan, Pakistan, archaeologists found something that rewrote the history of medicine. 11 drilled human molars from adult burials, dated as far back as 7000 BCE, stand as the earliest known evidence of dentistry in human history. At least 9 people had holes drilled into their molars and survived the procedure, pushing the dawn of dentistry back by 4,000 years. This was not a fluke. Lead author David Freyer of the University of Kansas noted the practice lasted around 1,500 years at the site, a genuine tradition rather than an isolated event. How do you drill a tooth in the Stone Age? With a bow drill, a stringed wooden bow tied to a rotating spindle tipped with flint, the very same tool local craftsmen used to bore holes in beads of turquoise and lapis lazuli. Microscopic examination showed precise circular holes, and signs of healing around them proved the drilling happened while the person was alive. The dentist was probably the village bead maker, the one person with steady hands and the right tool. It may go back even further. A late Upper Paleolithic specimen known as Villabruna from Italy shows a cavity that was scraped and levered with pointed flint tools. This is the oldest known evidence of someone trying to treat a rotten tooth, well before the Neolithic. The instinct to dig the decay out is almost unimaginably old. Removing the rot only gets you halfway. What about filling the hole? For that, travel to a cave near the village of Lonch in Slovenia, and a fragment of jawbone that sat in a museum for 100 years before anyone noticed what it held. It was a 6,500-year-old canine, belonging to a man aged roughly 24 to 30, with a vertical crack that had been packed with beeswax. Researchers using radiocarbon dating, micro-CT scanning, and infrared spectroscopy confirmed the filling and dated the jaw to between 6,400 and 6,650 years old. If the wax was applied while he was alive, it was meant to relieve the pain and sensitivity of chewing on a cracked, worn tooth, making it the earliest known therapeutic dental filling. Someone looked at a broken tooth 6,500 years ago and thought to seal it. By the time we reached the early civilizations, dental care had a name attached to it. In Egypt's 3rd millennium BCE, a scribe named Hesi-Re served at the court of the pharaoh Djoser. His tomb carries an inscription honoring him as the greatest of those who deal with teeth, the first person identified as a dental practitioner. The Egyptians fought toothache mostly with the pharmacy of the natural world. Remedies recorded in their medical papyri included chewing anise seeds and applying pastes made from ground cumin, frankincense, and carob. The Berlin Papyrus recommended willow leaves for toothache. Willow bark contains salicin, which the body converts to salicylic acid, the basis of aspirin. That is not folklore. It is pharmacology 4,000 years early. For truly unbearable pain, the Egyptians may have reached for opium. They also improvised fillings. One Egyptian man, mummified around 2,100 years ago, had numerous cavities, and the largest had been carefully packed with linen, possibly soaked in medicine to keep food and pressure off the exposed nerve. The Greeks brought theory. Both Hippocrates and Aristotle described the eruption patterns of teeth, the treatment of decay and gum disease, extraction with forceps, and the use of wire to stabilize loose teeth and fractured jaws. However, for sheer craftsmanship, nobody beat the Etruscans of central Italy. As early as the 7th century BCE, they were building dental prosthetics. They crafted bands of gold that fitted around surviving teeth to hold replacements in place. These gold bridges were worn mostly by women, which suggests the main concern was cosmetic. The Etruscans are also credited with inventing the first orthodontic appliances. 2,500 years ago, you could get a gold bridge fitted. The Romans inherited that skill and added a careful surgical hand. The encyclopedist Celsus described a meticulous tooth extraction technique not unlike modern textbooks. Crucially, he treated extraction as a last resort, reserving it for after every drug and remedy had failed. Before pulling a tooth, the gum was scraped back and the tooth loosened by shaking until it could come out safely. Loose teeth could be tied to their neighbors with gold or silk thread. Cavities themselves were sometimes plugged with wood or lead. Gold dental work was so valued that Roman law made a famous exception. Corpses could not be buried with gold, unless that gold was in their teeth. On the other side of the world, China developed something we would recognize instantly. An early Chinese medical text describes a silver paste for filling teeth, a mixture remarkably similar to the silver amalgam dentists still used in the 20th century. Here is the twist most people miss. We tend to imagine ancient dentistry as superstition and brute force. The superstition was real, including the worms, incantations, and charms. Yet woven right through it was a body of treatment that genuinely worked. Willow really does contain the active ingredient in aspirin. Clove oil, used for toothache across the ancient world, contains eugenol, an antiseptic and pain reliever that, combined with zinc oxide, is still used in dentistry today. Beeswax really does seal a cracked tooth, and removing decay really does stop it spreading. These people were running a kind of slow-motion clinical experiment by trial and error across thousands of years. Which brings us back to you, lying awake with that throbbing molar. Whatever century you are imagining yourself in, you are not alone in it. Every human who ever lived carried the same vulnerable little arsenal of enamel in their jaw, and a staggering number of them felt exactly what you have felt. They drilled, packed wax, chewed willow and clove, wired gold around their teeth, and begged worms, gods, and saints for mercy. The pain is ancient, but so is the response to it. That stubborn, universal refusal to simply lie there and suffer. The throb in your tooth is one of the oldest conversations our species has ever had with its own body. We have been answering it in flint, beeswax, and gold for 9,000 years.